He is with ProCure Proton Therapy Center in Somerset. And it's always great to welcome back Dr. Edward Soffen to WCTC. Dr. Soffen, good morning. It's Bert Barron. How are you?
Hi, good morning, Bert. Great to be back.
Yes.
And just congratulations on all the awareness that you're bringing to the population about breast health and breast awareness this month. And I'm proud to be a part of that.
Well, thank you. So critical, so important. I've been at events all over the state, and we have, of course, some things still to get to in November. And it remains a high priority, Dr. Soffen, and I'm glad that any exposure that I can give to this, of course, is a pleasure for me. But we're still looking at some pretty high numbers, Dr. Soffen. 1 in 8 women will develop invasive breast cancer over the course of their lifetime. And we're talking about numbers, just about a 250,000 new cases in 2018. It's remarkable how the numbers are still kind of up there.
I know, it's astounding. And, some of it I think may be environmentally related, but it's also because we are detecting more cancers because we're screening women earlier. As women and men become more aware of their breast health, they are going for annual screening mammography. We're picking up these cancers earlier and, therefore translating into a much higher cure rate.
Yeah, and that's important, of course. In terms of trends, are you seeing more diagnosis, Dr. Soffen, and maybe you can pinpoint it, maybe you can't, more cases maybe with younger women or maybe more cases with older women in recent years that we've seen here in Jersey?
Yeah, it has been showing a higher increase in younger women, but I think that's because recently the American Cancer Society, American College of Radiology has suggested changing the screening patterns from age 50 to age 40. So we are picking women up earlier. I'm not sure that they're developing it earlier, but that we're just picking it up even, 5-10 years earlier than it would have been because we're screening women earlier.
Right. And for any woman or a man who gets a diagnosis of breast cancer, what's the first thing you do if you're diagnosed? And navigating treatment options can be kind of tricky. What's the first thing you should do?
Yeah, it's very complex because the treatment of breast cancer is multimodality, meaning a surgeon is involved, oftentimes a medical oncologist for chemotherapy or hormonal therapy, and of course a radiation oncologist. So it's really getting to the right surgeon initially to do the biopsy and then finding out what your options are in terms of treatment. Many women do not need to have a mastectomy. They do not need to lose their breast. One of the standards of care, which is highly visible and offered to most women, is breast preservation, where they have the tumor removed and then their breast is treated with radiation. And I think it's important that women get all opinions before they jump onto one of the trains that takes them one way or the other. So you really have to navigate by having a good team, breast surgeon, radiation oncologist, and medical oncologist.
For the service that ProCure offers, Dr. Soffen, who does that work for and why? Is it effective for virtually everyone?
Well, ProCure does offer a type of radiation which is a proton beam, so it's a particle. And what's interesting about this particle is it goes into the breast tissue and it stops. And so pretty much any woman who has breast cancer and who needs radiation or who has opted for radiation in lieu of a mastectomy can have proton therapy. Now, women who have left-sided breast cancer would probably benefit more than women who have right-sided breast cancer because the heart is right under the left breast. And what's so important about the radiation when it comes in, that it goes into the breast and stops and doesn't treat the rest of the normal tissues like the lung and the heart, which are right underlying the left breast. Now, on the right breast, the lung is also there, so protons also offer a decrease in lung toxicity in women who have right-sided breast cancer. But, to answer your question, any woman who has breast cancer is probably going to be a candidate for proton beam.
And what can a woman expect, Dr. Soffen, when she visits ProCure? Is it something where she goes in a morning and undergoes her treatment and leaves the same day and goes to work and goes back into doing her thing in the same day?
Yes, we lavish care on patients. So we have a full staff of concierge service, nursing, some of the best therapists in the country. And basically people will come every day, Monday through Friday, 5 days a week for a certain number of weeks. It may be 4 weeks, 5 weeks, 6 weeks, depending on their case. They come in. We treat from 7:30 in the morning till 10 o'clock at night. They'll come in for their treatment. It's about 10 or 15 minutes. the machine is on for 1 or 2 minutes. Most of the time it's just setting them up, and then they go about the rest of their day. I mean, it's almost like going to the supermarket, buying some milk, and leaving. I mean, it's a little bit more complicated than that, but you come in, you get treated, you go to work or come back from work, and it's quite simple.
Yeah, you start getting kind of beaten up after a while, Dr. Soffen, when you start reporting, fatalities and mortality numbers. But how about more than 3.1 million breast cancer survivors in the United States? That's the number that we want to drive up, obviously.
I know, absolutely. If this is caught early, the cure rate is extremely high. It's way up into the 90s percentage. And so, again, we have to stress, and I thank you for doing it, that early detection leads to early diagnosis, leads to a very high likelihood of cure. And there's so little toxicity with the protons that, since women are living decades and decades after their diagnosis, we want to make sure that they don't have any long-term issues that they have to deal with from the treatment. We want to make sure that the treatment isn't worse than the disease.
Absolutely. And one last thing for you, Dr. Soffen. I was at an event in Perth Amboy a couple weeks ago. I had a chance to talk to some survivors, and it was this sort of celebration of life event that I had the privilege of attending, and it was really spectacular. And I was talking to someone who was a survivor. And I can ask you this because I'm a grown-up and so are you, but they say a lot of times, in many cases, detection is made in a moment, I guess you will, a moment of intimacy, when a woman is with her partner, be it a man or another woman, where, oh, hey, something's just not right. I noticed something kind of weird. And they'll go and they'll be checked, and that is their early detection. That is because, someone other than them detected something on their body. Do you hear stories like that sometimes, Dr. Soffen? Well, my husband pointed this out to me, so I figured I would get it checked out. Do you hear stories like that often?
I hear that all day and every day. Yes,
you do.
A woman may be doing self-breast examination, or her partner noticed it during a moment of intimacy, and that leads the whole cascade down to early detection and diagnosis. And it also underscores the fact that women and their partners need to know their breasts in a way that they do self-breast examination and be self-aware, so that if there is a change, they can note that change. So self-breast examination and having a partner examine their breasts is also very important.
And I'm just a big kid, Dr. Soffen, so I chuckled a little bit when I first heard that, and then I got to thinking, I'm like, wow, I mean, maybe a buzzkill at the moment, but you might have saved a woman's life. You might have saved your partner's life just by speaking up in that moment right there.
Absolutely. I know. It is a buzzkill, I'm sure, but it's worth it because from there on in, they're going to have their partner for decades to come, rather than losing them to a cancer that otherwise could have been treated early and cured.
Absolutely. It's absolutely worth speaking up on, that's for sure. If someone wants more info on ProCure, Dr. Soffen, how do they get it?
Well, ProCure.com, easy to find on the Internet. The phone number is 732-357-2600. That's local call. And give us a call, and we'll be happy to schedule an appointment.
All right. Dr. Edward Soffen with ProCure. Thanks, as always, for the time, Dr. Soffen. And you and Dr. Chan and everybody at ProCure, all the best to you guys, and keep up the great work, and thanks for the time today, all right?
Thank you. Always a pleasure.